Hello everyone, I welcome you all to today's webinar on challenges of infection prevention and control and antimicrobial stewardship during COVID-19 pandemic. I am Dr. Amrita Patil and I will be moderator for this session. This webinar is being conducted as a part of the project Prevented. The vision of the project is future where every individual is aware of antibiotic resistance and is empowered with the right education to address the issue of ABR. The project is implemented by a consortium comprising 5 Indian universities, 4 European universities, and 2 non-governmental organizations. The concept of infection prevention and control has gained a lot of momentum during the time of COVID-19. On the one hand, our healthcare professionals are putting tremendous effort to combat the situation. But on the other hand, the parallel non-prudent use of antibiotics makes the situation worrisome. In order to address this issue, we must understand the loopholes and challenges being faced by our lifesavers. And today's webinar specifically target this problem. After attending this webinar, you will understand the basic challenges of infection prevention and control. Also, you will gain insights into antimicrobial stewardship programs. So now moving towards technical details of the webinar. The webinar is being conducted on Zoom and we are directly streaming it on YouTube. If you have questions for our speaker, please type your questions in the chat box. While typing a question, please begin by typing #AskPrevented. I repeat, while typing a question, please begin by typing #AskPrevented so that we'll understand that these are the questions you want to ask our speaker. We will try to address all questions at the end of the session. We are keeping aside 15 minutes for the question answer session, so please use this opportunity to enhance your knowledge. Additionally, in order to make the session more interactive, we are conducting live polls during the webinar. So those joined through the Zoom link can participate in the online poll. I would also like to add that this webinar is being recorded so that whoever is not able to attend the live session will be able to listen to it later. The session will be posted on the official website of Prevented and also on Facebook, Twitter, LinkedIn pages of the project. And last, we would like to encourage you to share today's webinar with your social network. Now, I would like to introduce our speaker, Dr. Carlos Palos, a very special guest from Catholic University of Portugal. Dr. Carlos is a specialist in intensive care medicine. He is an assistant professor and conductor of the course Adult and Elderly Pathology of Nursing degree at the Institute of Health Sciences, Catholic University of Portugal. He is also a collaborator for the course of Introduction to Clinical Practice of the Integrated Master of Medicine at Nova Medical School. He is also actively involved in the local implementation of PPCI-RA, that is, Program for the Prevention and Control of Infections and Antimicrobial Resistance at Hospital Beatriz, Ângelo. And previously, he was involved as a member of the board of PPCI-RA of the Portuguese Health Directorate. In addition, currently he is a member of the European Society of Clinical Microbiology and Infectious Diseases. Today, he'll be giving insight on the topic challenges of infection prevention and control and antimicrobial stewardship during the COVID-19 pandemic. So without any further ado, I would like to welcome our speaker, Dr. Carlos Palos. Over to you, Dr. Carlos.
Thank you very much. It's an honor and a pleasure to be with you. It's afternoon for you, it's morning for me here in Portugal. So I'm representing the Catholic University of Portugal. With this image is the Lisbon Catholic University, because there are several others facilities, and that's where I give my classes on the Institute of Health Sciences. But in the future, that means next year, it will start a new faculty of medicine in the Catholic University of Portugal, which will be the first private course of medicine in Portugal, which is a collaborative initiative between the Catholic University and the Hospital da Luz group, where I also work. So thank you very much. I hope that in the few minutes you will be more able and more knowledge about these issues related to COVID-19 pandemic in terms of infection control and also antimicrobial stewardship. So let's start. And I share with you these fabulous images of Lisbon. Maybe most of you don't know Lisbon. So Lisbon is a very shiny city. Portugal is a small country. It is the western country of Europe, and we have historic relationship with India. Even our prime minister is from Indian origin. His parents were from Goa. So these are images from Lisbon, the castle of Lisbon, the bridge of Lisbon, the Tagus River, the main place of Lisbon. We live near the river. We love the river. And this is the new part. So we are moving between the old and very brand new things. So after this, well, welcome to the major threats to humankind, a short history from one to the world, the infection prevention and control during the pandemic, the antimicrobial stewardship during the pandemic. And these are the 4 topics that I've selected to share with you. So let's go to the first topic. We know that there are some global risks for the humankind, and the World Economic Forum in the edition 2019 as pointed out as the weapons of mass destruction and the issues related with climate change as the major problems. And you can see here 2 covers of the Time magazine. Both are related with Portugal, because the first one is the Secretary General of the United Nations, which is Portuguese, and the second cover is from Greta Thunberg, that you know who is she. And this picture was also taken on the on the coast of Lisbon. But you can see that in the 10th place, there is the spread of infectious diseases. And when we move towards the World Health Organization 10 threats to global health, we can see that, okay, we start every time with the issues related with climate change and air pollution. We pass by vaccine hesitancy, which is a stupidity. You as healthcare workers, you should combat actively the vaccine hesitancy. We need desperately a new vaccine. So why to have this behavior of not vaccinating ourselves or our children? But we have antimicrobial resistance as a major challenge and a major problem, as we will see after. And of course, the Ebola and other high-threat pathogens were already identified as major threats to humankind in 2019. And when we move towards the last century, we can see that there were several pandemics in the history. Those pandemics caused by virus, and the present one is the first one that is caused by coronavirus. Even if we have situations with coronavirus, they were firstly contained on Asia or China or specific places just like Egypt, for example. And the issue is so important that, in fact, Bill Gates, on a TED Talk on March 5 years ago, he said that we are not ready for the next epidemic, or worse, for the next pandemic. And he explained that in a short YouTube video of 8 minutes. I invite you to see it, okay? So in order to be more interactive, I have one question now. Do you think we were prepared for this new pandemic? Can you vote yes or no?
Now participants will see one question in front of their screen, on their screen, so they can respond quickly.
Yeah.
Okay.
So we have now about, that's good, more than 100 persons voting. That's very good.
Yes.
Okay.
So I'll stop sharing the question now.
Yeah. So we can see that 90% of you think that we were not prepared for this new pandemic. And I think it's the common idea that we all have. Okay, let's move on to the next topic. So let's take a picture, a brief history of this pandemic from Wuhan to the world. And what is said is that on the last day of the last year, we had a problem on the fish market of Wuhan. So 2 patients were first identified as having a respiratory disease. And on the 30 January, the United Nations constituted a public health emergency of international concern. And as you know, on 11 March of this year, it was declared a pandemic. So when we look at this table, we can see that on the 2 January, the problem started on China. Then it spread to the countries that are nearby. And then, for example, India had its first patient on the last day of January. And I can tell you that Portugal has the first patient on the 2nd of March. So those first cases were all related with China. And now this is the figure of, these are the numbers of the day before yesterday. So we have now more than 40 million people affected all over the world, and more than 1 million deaths. And when we look at the countries, we can see that the country with the greatest number of cases is the United States, just followed by India. And in Europe, Spain is having a huge problem. When we see the total cases by million inhabitants, we can see that Peru in South America is the leading one. And when we see the total of deaths by 1 million persons, we can see also that Peru is leading the problem. For example, India has a low rate of deaths per million. Of course, this total number of cases is dependent on the tests per population. And you can see, for example, that if India tests the same amount of patients as the United States, the numbers will be exactly the same in terms of the total number of cases. By the way, Portugal ranks 40 in the 46th position, but all those countries are worsening their situation as we are now facing the second wave in Portugal. What we know is that COVID, so the infection caused by SARS CoV-2, is not as infectious and not as deadly, for example, as measles. The problem is that we don't have any vaccine. That's why I say it's stupid not to vaccinate. But we have a lot of unknowns and questions even now. So we don't know exactly how it started. We have doubts about epidemiology, and we have no effective vaccine yet. And therapeutic strategies are changing all over the time. So now we know that remdesivir, which is antiviral compound, is not as efficacious as it was thought before. So this is the issue of the origin. So we don't know. Did it start on bats? Was it on pangolins? Was it on other species? And the exact starting point, we don't know it also, because scientists from Harvard, from Boston, when they looked at the hospital traffic in the parks and engine data for searching on the internet, some symptoms just like cough and diarrhea, they found that there might be was a problem before, and the problem it could be on October or September 2019 and not only on December. So we have doubts about the origin, the moment of the origin. So another unknown or debatable question is about the temporal dynamics of viral shedding and transmissibility. So according to some authors, 44% of transmission could occur before the first symptoms. And this is a huge challenge, because we are facing that asymptomatic patients are in fact transmitting the disease. Another challenging point is regarding to the diagnostic tests that we use. So nasopharyngeal swab for PCR for detecting viral RNA, you can see it starts here, but then it goes down according to the weeks. And we have also virus isolation, what we call the antigen isolation on nasal swabs. And other issue is related to the antibodies that we don't know exactly when they start, how much do they achieve, and which degree of protection they give. So we have a lot of issues that are not completely closed. And also, we can see that sometimes some patients have a lot of repetitive tests positive for a long time with PCR for the virus. But in fact, this could not be neither a reactivation, just false positives. So that's why some countries are now not relying on new tests, new repetitive tests, and consider that the patients are cured if they have not symptoms. And finally, another debatable question that is always on the table is regarding the importance of airborne transmission, that means aerosols, regarding droplets. And this is a Science magazine from the last week, from last Friday, and some authors are saying that aerosols that are generated by our cough and our speech could be more contagious than the droplets. And so the issue is still debating on, and it could have an impact on the type of protective equipment we should use. So now we are going to another poll section. So in your opinion, which is the origin of SARS CoV-2? This is a provocative question. Do you think it's natural, or was it human-made?
We are getting very good response from participants.
Yeah, it's nice to see those bars changing.
Okay. I'll end this poll.
Yeah. So most of you think that the origin of SARS CoV-2 is not natural, it is human-made. That means that something happened on a laboratory, and it could probably escape to outside of the laboratory and outside of the control of authorities. So this is interesting. Yeah, we'll never know that. So let's go on to another question. When do you think that the initial cases, the first cases, really appeared? In December or before December 2019? So you can vote. Yeah, we can stop. Yeah, so 70% of you think that it was before December. Yes, and we think it was before December. We don't know exactly when, but it was before December. Yeah. So one other question. In your opinion, which is the most important way of SARS-CoV-2 transmission? Is it by contact, by droplets? That means big airborne particles, or is it by aerosols? So you're voting, yeah.
YouTube participant can also give their response by typing in chat box.
Okay, I think we can close. So most of you agree that is by droplets, that it is by large particulate that we generate from our respiration and from our mouth. And it's, in fact, it is the most important one. The second group was saying that is generated by aerosols. That means 85% of you think that it is related with respiration, which is correct, and 15% of you say that contact is the most important way of transmission. So let's move on to the infection prevention and control. What we have done, what we have changed during this pandemic. So we are in Europe, and in Europe there is the European Center for Disease Prevention and Control, which is in Stockholm, in Sweden. And in this slide, we can see what the hospitals should do. And the first thing is to have a response committee, which is very important because all the activities must be coordinated. And of course, we have to prepare for the critical ill patients. We have to restrict or to stop non-essential visits and also non-essential activity, which is a huge problem because people with non-COVID situations is lying behind. So they will be more disease and they will be more dead. And of course, we have to ensure training and adequate PPE, personal protective equipment availability, and also strategies for identifying and separate patients. And when we go towards our local activities, we can see that we can act on patients and citizens, on healthcare workers, on environment and circuits. And of course, the diagnosis and treatment of COVID and non-COVID patients is essential. Of course, we have to assure an adequate migration of information, for example, for the public health authorities, okay? But we are going to focus on the healthcare workers, on the environment and circuit. So on the healthcare workers, we can see that we need to improve awareness and knowledge of COVID and infection control and prevention, both as healthcare workers or as citizens, because we are citizens. And if we don't behave correctly, properly outside our facilities, we will be contaminated and we will bring the virus into the hospitals. We have to assure adequate personal protective equipment availability. We have to assure the adequate recognition and follow-up of healthcare workers that have close contacts with positive confirmed cases or symptoms that could be the ones from COVID, for example, respiratory syndromes. We need to avoid psychological fatigue, and of course we have to assure adequate payment in case of diseases or quarantine. And on the environment and circuits, we have to assure safe and clean environments. We have to create a separate circuits for respiratory and non-respiratory patients on the emergency department. And then after we know that the patients are COVID or non-COVID, we have to separate circuits and wards for these two groups. One of the major issues is the protection of healthcare workers. And an interesting paper was published by Wang in March, and he saw that there were 4 reasons for healthcare workers to be infected with SARS CoV-2. The first one is that people were not aware about the personal protective equipments, and also they did not understand the pathogen. So they did not knew it at all. But the most important, I think, are the next one. So long-time exposure to large scale of infected patients was related with some fatigue, some non-compliance, and to higher pressure and higher exposure. And you all remember some videos and some pictures of healthcare workers completely exhausted. So at that time, they were not putting their personal protective equipments properly, and they were not protecting themselves. Also, there was a shortage, and there is a shortage of personal protective equipment. And so they could be not well protected because they didn't have it at all. And fourth, and not less important, is that the healthcare workers did not receive adequate training for infection prevention and control. And I can assure you that this is a problem all over the world, because in the medical schools, in the nursing schools, there is a lack of proper training and proper education and proper awareness about these issues. Specialists, for the physicians don't care at all about these issues. So I'm always trying to train them in our facilities, and they are the less receptive for this because they think they know everything about that. So I'm not going to read all this, but this is adapted from the British Psychological Society about the needs of healthcare staff in the coronavirus pandemic. And you can see that in the beginning, we start with anxiety. Then we became heroes, but then we started to be with disillusionment and exhausted. And we are always moving between those 4 phases. And then when the things went out, so we have the recovery phase, but we had long-term psychological impacts. And we are now again on this phase. So we are now exhausted because we are on the second phase on the second wave of the pandemic. And the Institute for Healthcare Improvement of the United States highlights this very important concept. is the psychological personal protective equipment. So not only the gloves, the masks, the gowns, but also the psychological way of being. And in fact, we could not accept that we live in paranoia, that is the paranoia of coronavirus. We cannot live on that. We must live on safety. So the World Health Organization, in fact, has increased and recommended some strategies related to the approach of suspected or confirmed COVID-19 patients. So now every patient that is in the hospital or in other facilities, healthcare facilities, they need to wear a mask, and they should wear a mask during all the time. It's very important. For the healthcare workers of care, of course, everyone should wear a mask inside the hospital and should have wear eye protection. That means a face shield or goggles, even if you are not attending COVID-19 patients, because you don't know if that patient is truly a COVID patient or not. Okay, and for the ones for the situations where it is expected to contact with fluids, you should also have long-sleeved gown and use of gloves, or this applies also to all the patients that are confirmed with COVID-19. And one very important issue is to change from the mask to a respirator, an FFP2 respirator or a KA95 or equivalent. You should do that for aerosol generating procedures. And this should be a practice, not only for COVID-19 patients, but for all patients. And it should be like this every time. But now it is more important than ever. Moving on to the environment and circuits, of course, we have to implement isolation and to recognize as early as possible these patients. So we need to have triage stations at the entrance of hospitals, and not only hospitals, also healthcare facilities, in order to ask some questions that could point towards a possibility of being with COVID-19. So we have to implement administrative controls, and that means education, also recognition of acute respiratory infection. Look, preventing overcrowding is very important. We cannot have overcrowding in our facilities, especially in emergency departments, but I call your attention also for the situations of the waiting rooms. So, and of course, we have to supply adequate amounts of personal protective equipment, and they have policies and procedures that are known by the persons. And of course, we have to improve basic infrastructure, mainly to assure adequate ventilation. That means to increase the numbers of ventilations per hour, and also to put always new air inside any time that there is a new ventilation. That means not reusing the air that is coming from the facilities. These are some pictures of my hospital, which is a 425 bed secondary hospital near Lisbon. And you can see it's the entrances of the adults emergency department, and we have a container there. So we had to expand the capability of the hospital in order to accommodate more patients and differentiate them and separate them. This is a waiting room now, and this is the entrance. That it was firstly the main entrance of the hospital, and now it is only the entrance for respiratory symptoms. and this is the respiratory area, and this is a ward which is a COVID ward. So here, all the patients that are in this ward are only COVID-19 patients. So there is a line, and the people that are working to the left of the line, so nearby the patients, are more protected than the other ones that are supporting those ones. These are the controls on the entrance. So now they are they are greater. And this is one machine that allows you to have the alcoholic solution and to read your temperature and sees if you have a mask in place. And this is a control, this is a maintenance man, which is controlling, is sampling for the virus, and the tests, I can tell you that in the air conditioned were negative. So some questions. In your opinion, what was the major drive for an inappropriate use of personal protective equipment in the beginning? Poor knowledge, or poor compliance, or limitations of PPE availability, or you don't know at all?
Okay, I'll end this.
Yeah. Okay, so okay, it's PPE availability limitations and poor knowledge about infection prevention and control were the same, 44 and 45%. And I think I absolutely agree with you. I think it's the same in my case. I think it was the poor knowledge about infection prevention and control, because people were aware about that before. Okay, so another question is, in your opinion, in comparison with the beginning, what is different now? So have we improved our infection prevention and control knowledge? Healthcare workers are using more appropriately? There are less PPE availability limitations, all of the above, or none of the above? So you are voting, yes?
Okay, I'll end this poll.
Yeah. So most of you said that all of the above are contributing to the new situation. So 65% of you said that is the main difference. Okay. And finally, for this group of topics, in your opinion, which is the major challenge for keeping up an adequate response? Is it facility related? That means infrastructure, human resources related, or financial related?
Okay, I'll end this.
Yeah. So most of you, but with a little difference, said that financial related issues are the most important, 38%, just followed closely 35% by human resources related, and facility related was pointed out by 28% of you. In fact, this of course depends on our experience and our context. So in one case it should be financial related, and in the others human resources related. For example, in my hospital, just to share with you, I think human resources related is one of the most important issue, because we don't have enough people if there is enough healthcare workers, if there is a huge amount of situations. Okay. So let's move on for the last topic, which is antimicrobial stewardship during the pandemic. And I start by sharing with you a slide that was prepared initially for the Prevented Bootcamp at Milan in March. And as you can see, 700 people die annually with infections caused by antimicrobial resistant bacteria. This is a huge number, And by 2050, this number increases to 10 million people, just like a country as Portugal. And the major drive for bacteria to become resistant, because they will always be resistant as a natural adaptive way of the bacteria, is that we cause too much pressure on that using antibiotics. And as you can see, 30 to 50% of all antibiotics are inappropriately prescribed. For example, an antibiotic prescribed to a flu is not appropriately prescribed. For example, if you select a large spectrum antibiotic, just like, for example, meropenem, or even piperacillin tazobactam to treat a community-acquired infection, you are not doing an appropriate selection. So in order to improve the antimicrobial prescription, there was a concept that was developed, and at least it is published since 2012, which is the concept of antimicrobial stewardship, that are coordinated interventions that are designed to improve and measure the appropriateness use of antibiotics by promoting the selection, the optimal antibiotic drug regime through including dosing, duration, therapy, and route of administration. And the purpose is to have the best clinical outcome while minimizing toxicity and reduction the antimicrobial resistance. So this should be seen as a focus for patient safety. And in fact, what we are talking about is to transform what is an individual prescription that is dependent on the infection with the setting. So I select an antibiotic according to the setting. I do some dosing and decide some timing, but I transform it in a team prescription, because there is a stewardship team that is going to see the antibiotics individually and is going to suggest corrections or to correct themselves. So regarding to the COVID-19 pandemics, and according to the WHO, of course, this is a viral infection, not a bacterial infection. And so empiric antimicrobial therapy should not be used unless there are some specific situations. And what we saw is the generalized use of antibiotics in the context of these infections. So, which is not absolutely correct at all. But this situation is improving as the pandemic is moving on. And as I've told you before, we need to have people to see the prescriptions. And one of the major issues regarding the COVID pandemic is that resources are directed away from antimicrobial resistance surveillance. I can tell you that, for example, in my hospital, because we all were very involved on the management of patients or on the management of the global situation, in fact, we had to stop for a short time these activities of reviewing what was done. Okay? And on a short communication just published last week, just like the other article, the other paper, Antimicrobial Stewardship Program, a vital resource for hospitals during the global outbreak of coronavirus. These are not the conclusions of the authors. These are the conclusions that I removed from their paper, because I think these are the most important. And the most important is that at the start of the pandemic, the authors received the support from hospital management to maintain the antibiotic stewardship program as an essential service. This is very, very important. This is a paper from South Korea. Okay, then they said that because they had to change from person-to-person contact to computerized ways of doing their stewardship. And finally, they conclude that there is a need to employ digital platforms and to continue to develop robust surveillance systems. And in fact, in my hospital, we work with e-health solutions. That means that we were not working on close contact. We use emails and other alerts in order to alert the prescribers in order to correct what is not good. But what we will see in the next months is that the consequences of the pandemic on antimicrobial prescription, it will be dependent on what the people of that hospital have before in terms of behavior. So if they have a good behaviors, if they have a good culture of prescription, they wouldn't change a lot in opposition to the other hospitals where the appropriateness is highly dependent on the activities of the antimicrobial stewardship teams. That is very interesting to see, and the future will, of course, see what was the impact on that. So just to finish, were antimicrobial stewardship activities maintained in your premises facility during the COVID? So yes, as usual, yes, but with restrictions, not at all, or you don't know. Please vote.
I'll end poll.
Yeah, I think we can stop.
Yeah, it's still increasing, bars are still. Okay, I'll stop now.
Yeah. So for those who know, because most of you don't know, yes, with restrictions. Yes, I think it's the what happened in the most cases. Okay. So, in your opinion, do you feel that antibiotic use in COVID-19 patients was appropriate in your facility or globally? Can you please vote? I think we can stop voting.
Yeah.
Yeah, so most of you say no, 49%. Yes, it's probably the correct answer. So we gave too much antibiotics for those patients. Yeah, but as I've told you, next month we'll have some data on this. And the last question of all, in your opinion, how much the problem of antibiotic resistance has been affected by the COVID-19 pandemic worldwide? Severely, moderately, not affected, or you don't know? Yeah, please vote. So I think we can stop.
Okay.
Yeah. So moderately, most of you, 60% said that there will be a moderate affection of the resistance problem. Yeah. Okay. So just to finish and take on some messages, the SARS CoV-2 COVID-19 pandemic represents a major challenge to humankind. We will still have many unknowns and doubts about the situation, and the situation, as you can see, is far from control. The personal protective equipment and basic precautions of infection prevention and control were escalated. We are now using things that usually we didn't use by normal. And healthcare circuits and facilities have been redesigned. And finally, antimicrobial stewardship activities have been affected, and the impact on microbial resistance is still to be determined. So thank you very much. We are now going to move on to the questions and answers part regarding your questions. And I'm going to start to stop my sharing. Sorry for taking a little more time, but I think it is interesting. Yeah, thank you.
Yeah. Thank you, Dr. Carlos, for interesting and informative session. It was pleasure listening to you. Here, I would like to mention that we have got excellent participation for this webinar. Almost more like 204 participants are there with us currently on Zoom, which is one of the very, very good thing about this initiative. So, Dr. Carlos, should we go ahead and take some questions?
Yes.
Yeah. Just a reminder to all participants, please be sure to type your questions into chat box with hashtag #AskPrevented. Okay, so we have one question that is like, we do understand that vaccine is the need of the hour, but there is a lot of cost involved in its development. Along with that, the virus shows genetic changes. So what's your take on this, Dr. Carlos?
Well, I think that vaccines are coming, so they are on the way. Pharmaceutical companies and the governments are committed to their development. It's a huge amount of money, yes, but I think they will be on the next months regarding the genetic variation. So what we know now is that we can produce a vaccine for this virus, but this could be just like a flu virus. So from time to time it could change, and the change will oblige to create a new immunization profile. But as we have the first one, it's easier to do to build up the other ones. Yeah, good question. Yeah, thank you.
Thank you, Dr. Carlos. Another participant, Mr. Ayush Pillai, he is asking, does a COVID positive patient develop permanent immunity against the virus after recovery? Or there is chance to get infection once again if that person get exposed to virus?
Well, those are difficult questions to answer. What we know now is most of patients somehow acquire some immunization, but we don't know how far and how much. And there are some cases of evident reinfection with the virus. So we are still trying to understand what is really happening. If the virus stays in the people and somehow it becomes active after by some kind of reason, or if there is truly a new infection. Yeah, we don't know at all, absolutely sure about that.
Okay. Mr. Shripad, he is asking, what is the origin of COVID, whether human or some other source?
Yeah. So if you ask that to the president of the United States, Trump will say that it's the Chinese virus and that it was developed on some kind of artificial environment. In fact, we don't know. We don't know by sure, but we should admit that this natural virus resulting for recombining with within species and the China market and the other places in China had the potential because there are a lot of living animals there, so and human contact. So we can assume that it comes from the nature. Yeah.
Okay, thank you. Another question is, could you please explain what is second wave of COVID-19? Is it something like virus is re-emerging with greater potential, or it is something like people are not taking proper precaution and this is because of that second wave might come? Or is it related with the weather change? Like in India, some experts are saying that in December or January, there will be second wave of COVID-19. So and they are saying that it is this may happen because of season, like winter season and festive season. So according to you, what could be exact reason of second wave of COVID-19?
Yeah, what we are seeing in the countries that are facing the second wave is not directly related with the weather conditions. It's more related with the behavior of the persons. So citizens remain as reservoirs. And when people are connecting with themselves socially without masks on the meals and smoking and so on, so situations where you don't wear the mask, you are probably contaminating if you are positive. So just by talking or by coughing or sneezing. So of course, winter times, if you have a cold and flu season, it will easier the transmission of the virus between people because you cough more and you sneeze more. But it's not the most important thing. In Europe, what we see is that most countries are now facing a second wave because there is more social working, so things became too normal, and people are not complying all the aspects they should.
Okay. So one more question related to this second wave only, like you in your slides, in your presentation, you mentioned that in COVID, like in treatment strategy, antibiotics are used. So my next question is, like, according to you, what kind of precautions should be taken at individual and community level to avoid severe impact of second wave on antimicrobial resistance?
Yeah. So the decisions that should be made and are made on a global and national way are difficult because we cannot stop economy, we cannot stop the countries as we did some months ago, but everyone should be aware that we cannot be with our friends, we cannot be with people that we are not living, that means our close family in our houses, we cannot be with them as we were before without wearing a mask. So the most important things are the social contacts in the moments we don't wear masks, just like the meals and coffees and drinks and so on. So in more closed spaces. So of course we need to wear masks in closed spaces. We need to wear masks in open spaces where there is a lot of people. So because there is a higher probability of being contaminated, and mainly we should restrict our social activities, even if this is somehow difficult. But if we don't do that, we are spreading the virus for the other people and to our relatives, and especially for the most vulnerable ones, just like the elderly and the chronic disease patient. Yeah, that's my opinion.
Okay. Thank you so much, Dr. Carlos. It's already 2:30, so I think yeah. So Dr. Carlos, quickly, like, would you like to give some message to our participants?
Yeah. So first one, don't be paranoid. That means don't be paranoid about the coronavirus. So if you do the right things and if you protect yourselves, you will be safe. But as students, you should wear masks and you should behave well. If not, you are going to be contaminated, and you are going to contaminate all your colleagues and all your family. So be safe and behave safely. That's my message. I think it's the most important one.
Yeah, right. Thank you so much. Actually, thing is, we have got so many questions, but because of time limit, we can't take all the questions. We are thinking like whoever has like put their question will reply you all on YouTube. So thank you so much for your great like response. I hope you all enjoyed the session and did not face any technical error. We do apologize if someone faced any problem. As I said earlier, the recorded version of the webinar will be available on the website. So do visit the Prevent It website. Thank you, everyone. We appreciate you being here. Thanks for joining us today, and we do hope to come up with an interesting topic next time. Stay safe, stay healthy. Thank you.
Thank you.